Let me ask you something before we begin. Have you noticed that you feel more tired than you used to, even after a full night of sleep? Maybe your thinking feels a little slower than it did 5 years ago, or you get short of breath doing something simple, walking to the mailbox, climbing the stairs, and you tell yourself it is just age. I need you to hear this clearly. It is not just age. What you are feeling may be the result of something happening right now inside your arteries, silently, invisibly, with no pain, no warning sign, and no obvious symptom until the damage has already accumulated for years. After the age of 60, arterial plaque, a buildup of oxidized cholesterol, inflammatory debris, and calcium deposits along the inner walls of your blood vessels, progressively narrows the highways your heart depends on. Less blood flow means less oxygen to the brain, less fuel to the muscles, more fatigue, more mental fog, and a cardiovascular system working harder every single day just to keep up. Most people respond to this with another pill, another prescription, another expensive supplement with a long list of synthetic ingredients. But what if the most powerful thing you could do for your arteries was already sitting in your kitchen cabinet? What if your morning bowl of oatmeal, the breakfast you may already be eating, was one ingredient away from becoming a genuine artery-clearing, circulation-restoring, heart-protecting tool? I'm Dr. Joseph Barrett, physician with over 35 years of experience in cardiovascular and senior health. And today I am going to show you the 5 specific ingredients that transform ordinary oatmeal into one of the most powerful heart-protective breakfasts science has ever studied. Ingredient number 5 alone has been shown in clinical research to reduce LDL cholesterol by up to 15% in under 3 months. And ingredient number 1, the one I reveal at the end, is the one that surprises my patients most every single time. Stay with me through the end. Your arteries will thank you. But before I go any further, let me ask something simple and completely fair. What I'm about to share with you is real, physician-level information about arterial health and cardiovascular protection, backed by research from institutions like Harvard, Oxford, and the American Heart Association, that the pharmaceutical and supplement industries have a significant financial interest in you never fully understanding. Because once you know what these 5 whole foods do to your arteries at the cellular level, you may question why this was never the first conversation you had with your doctor. I put genuine research and care into every video I publish here. So if you believe that kind of knowledge is worth receiving for free, go ahead and hit the like button right now. That is the fair exchange I am asking for. Deal? And if you have not yet subscribed to this channel, do that right now and turn on the bell. Every week I publish practical, science-backed medical content created specifically for adults over 60. The kind of detailed cardiovascular information your doctor often simply does not have time to cover in a routine appointment. Ready? Then let us begin. Before we get to the 5 ingredients, I want to make sure you understand exactly what is happening inside your arteries right now, because that context will make everything that follows far more meaningful. Your arteries are not passive tubes. They are living, dynamic tissue, lined with a single layer of cells called the endothelium, which regulates blood flow, controls inflammation, and actively prevents the buildup of cholesterol deposits on the vessel walls. When the endothelium is healthy, it produces a molecule called nitric oxide, which keeps blood vessels relaxed, flexible, and wide open. After the age of 60, several converging processes begin to compromise this system. Chronic low-grade inflammation, driven by diet, oxidative stress, and declining hormonal regulation, damages the endothelial lining. Oxidized LDL cholesterol infiltrates those damaged areas and triggers an immune response. Macrophages, immune cells, consume the oxidized cholesterol and become what pathologists call foam cells, which accumulate as fatty streaks on the artery walls. Over years, these streaks calcify, harden, and narrow the arterial lumen, the interior channel through which blood flows. This process is called atherosclerosis. And a 2022 review published in the New England Journal of Medicine confirmed that it is present to some degree in more than 80% of adults over the age of 60 in the United States, the vast majority of whom have no symptoms whatsoever until the narrowing becomes severe enough to cause a heart attack or stroke. The encouraging finding of modern nutritional cardiology, confirmed by research from Harvard's Department of Nutrition and Oxford's Cardiovascular Research Division, is that specific dietary compounds can measurably slow this process, reduce existing inflammation in the vessel walls, lower circulating LDL cholesterol, and restore endothelial function even in adults well into their 70s and 80s. Oatmeal is the ideal delivery vehicle for these compounds, and I will explain why in a moment. First, the 5 ingredients. Let me start with the foundation. Oatmeal itself. Because before we add anything to it, you need to understand why oatmeal is the right base for this protocol. Oatmeal is one of the richest dietary sources of beta-glucan, a type of soluble fiber that behaves in a very specific and valuable way inside the digestive tract. When consumed, beta-glucan absorbs water and forms a viscous gel in the small intestine. This gel binds to bile acids, the cholesterol-containing compounds your liver produces for digestion, and prevents them from being reabsorbed into the bloodstream. The liver is then forced to draw additional cholesterol from the blood to produce more bile acids, effectively lowering circulating LDL levels. A landmark meta-analysis published in the American Journal of Clinical Nutrition, drawing on data from over 80 clinical trials, confirmed that daily oatmeal consumption reduces LDL cholesterol by an average of 5 to 10% within 6 to 8 weeks. The FDA has formally recognized this evidence, making oatmeal one of very few whole foods authorized to carry an official heart health claim on its packaging. But as powerful as oatmeal is on its own, its beta-glucan fiber works through a single primary mechanism. To truly address the full spectrum of arterial disease, the inflammation, the oxidative stress, the endothelial dysfunction, and the plaque calcification, you need to fortify that foundation with targeted co-ingredients. These are the 5. Ingredient number 5. Ground flaxseed. Flaxseed is one of the most nutritionally concentrated cardiovascular foods available, and one of the most consistently underused. Each tablespoon of ground flaxseed contains approximately 1.8 grams of alpha-linolenic acid, an omega-3 fatty acid that the body partially converts to EPA and DHA, the same protective long-chain omega-3s found in fatty fish. These compounds reduce circulating triglycerides, lower systemic inflammation, and improve the fluidity of red blood cell membranes, allowing them to navigate narrowed arterial passages more efficiently. But the defining cardiovascular benefit of flaxseed comes from its lignin content. Lignins are polyphenolic compounds that have a dual mechanism of action. They reduce LDL oxidation, preventing the chemical transformation of LDL cholesterol into the arterially damaging oxidized form, and they inhibit platelet aggregation, reducing the tendency of blood to clot abnormally within narrowed vessels. The clinical evidence is compelling. A 2013 Canadian randomized controlled trial, published in the journal Nutrition, Metabolism, and Cardiovascular Diseases, followed adults with peripheral artery disease who consumed 30 grams of ground flaxseed daily. After 6 months, participants demonstrated a 15% reduction in LDL cholesterol and a significant reduction in systolic blood pressure compared to the placebo group. One critical point on preparation: the benefits of flaxseed are only accessible from ground flaxseed, not whole seeds. The outer hull of the whole seed is largely impermeable to digestive enzymes, meaning the omega-3s and lignins pass through the gut largely unabsorbed. Purchase pre-ground flaxseed or grind whole seeds fresh at home and store in the refrigerator to prevent oxidation. 1 tablespoon stirred into your oatmeal each morning. That is all it takes to access this benefit consistently. Ingredient number 4. Chia seeds. Chia seeds have received considerable attention in popular health media, but most of what is discussed focuses on their fiber and hydration properties. The mechanism through which chia seeds specifically benefit arterial health is more precise and more interesting than their general reputation suggests. When chia seeds are exposed to liquid, they absorb up to 12 times their weight in water, forming the characteristic gel matrix you may have seen when making chia pudding. This gel slows gastric emptying and the rate of carbohydrate absorption, producing a significant reduction in post-meal blood glucose spikes. This matters for arterial health because elevated post-meal glucose directly triggers the oxidative stress and glycation reactions that damage endothelial cells. But the more targeted arterial benefit of chia seeds comes from their arginine content. Arginine is an amino acid that serves as the primary precursor for nitric oxide synthesis in the endothelial cells lining your arteries. Nitric oxide is the molecule responsible for vasodilation, the relaxation and widening of blood vessel walls that maintains flexible, open arteries and reduces the mechanical strain on the heart. A 2021 study from the University of Toronto found that daily chia seed consumption over 12 weeks produced measurable improvements in endothelial function, assessed via flow-mediated dilation, the gold standard clinical measure of arterial flexibility, in adults with established cardiovascular risk factors. Chia seeds also provide a meaningful dose of calcium, magnesium, and phosphorus, minerals that support the structural integrity of arterial walls and counteract the calcification process that stiffens aging blood vessels. Soak 1 tablespoon of chia seeds in water or milk overnight and stir into your oatmeal in the morning. The gel texture integrates seamlessly and requires no preparation effort on the day. Ingredient number 3, turmeric with black pepper. I want to be very precise about this combination because the black pepper is not optional. It is biochemically essential, and understanding why will clarify exactly how this ingredient works. The primary active compound in turmeric is curcumin, a polyphenol that has been the subject of over 3,000 published studies examining its anti-inflammatory and antioxidant properties. Its specific relevance to arterial health operates through 2 primary pathways. First, curcumin is a potent inhibitor of NF-κB, the master regulatory protein that controls the expression of the body's major pro-inflammatory genes. In the context of atherosclerosis, NF-κB activation drives the production of the inflammatory cytokines that damage endothelial cells, recruit immune cells to arterial walls, and sustain the inflammatory environment in which plaque grows. By suppressing NF-κB activity, curcumin effectively reduces the biological fire that feeds arterial disease. Second, curcumin improves endothelial function directly. A 2019 randomized controlled trial published in Nutrition Research found that curcumin supplementation over 12 weeks produced improvements in endothelial function comparable to moderate aerobic exercise in postmenopausal women, a population at significantly elevated cardiovascular risk. Here's the critical limitation. Curcumin has extremely poor bioavailability when consumed alone. The liver metabolizes it rapidly and the gut absorbs very little. The solution is piperine, the active compound in black pepper, which inhibits the liver enzymes responsible for curcumin metabolism and increases its bioavailability by up to 2,000%, according to research published in the journal Planta Medica. 1/4 teaspoon of turmeric combined with a small pinch of freshly ground black pepper added to your oatmeal delivers a clinically meaningful dose of bioavailable curcumin every morning. For additional absorption, the fat-soluble nature of curcumin means it is best consumed with a fat-containing food, which brings us naturally to the next 2 ingredients.
We are at the halfway point, and you have already learned 3 ingredients that address LDL cholesterol, endothelial function, arterial inflammation, and vascular flexibility through 4 distinct biological mechanisms. The next 2 ingredients are the most powerful on this list. Ingredient number 1 in particular, the one I am saving for last, is the compound that produces the most consistent results in my patients, and the one that surprises them most when I explain exactly what it does to arterial plaque. Before we continue, if you have not subscribed to this channel yet, please do that right now and hit the bell. Every week I am here with honest, research-grounded cardiovascular and senior health information. No products to sell, no sensationalism, just medicine explained clearly. I am grateful for every one of you who watches and shares this content. Now, ingredient number 2.
Ingredient number 2, Ceylon cinnamon. I want to be specific about the type of cinnamon because this distinction is clinically significant and almost universally overlooked. There are 2 primary commercial varieties of cinnamon. Cassia cinnamon, the most widely available variety in American grocery stores, contains high levels of coumarin, a naturally occurring compound that can be hepatotoxic at the doses used therapeutically. Ceylon cinnamon, sometimes labeled as true cinnamon, contains only trace amounts of coumarin and is the variety supported by the clinical research I'm about to describe. Cinnamon's primary cardiovascular mechanism operates through insulin signaling. Its active polyphenols, particularly cinnamaldehyde and proanthocyanidins, improve insulin receptor sensitivity at the cellular level, reducing the post-meal insulin spikes that drive triglyceride synthesis in the liver and promote the oxidative modification of LDL particles. A meta-analysis published in the journal Diabetes Care, reviewing 10 randomized controlled trials involving over 500 participants, found that daily cinnamon consumption produced statistically significant reductions in fasting blood glucose, total cholesterol, LDL cholesterol, and triglycerides, while raising HDL cholesterol in adults with metabolic syndrome and type 2 diabetes. But cinnamon's benefits for arterial health extend beyond glycemic control. Its anti-inflammatory properties, particularly its ability to inhibit arachidonic acid release from cell membranes, reduce the inflammatory signaling cascade that damages arterial walls, and its antioxidant activity directly counteracts the oxidative modification of LDL, the transformation of ordinary LDL into oxidized LDL, which is the form that actually initiates plaque formation in arterial walls. 1/2 teaspoon of Ceylon cinnamon stirred into your oatmeal each morning provides a therapeutic dose that is both clinically meaningful and completely safe for long-term daily use. Before I reveal ingredient number 1, the most powerful and surprising of all 5, I want to stop for just a moment. You have stayed with this video through 4 ingredients, 4 distinct biological mechanisms, and a level of cardiovascular detail that most people never receive outside of a medical consultation. That tells me you take your health seriously, and I genuinely respect that. So right now, go to the comments below and type the word circulation. Just that one word. It is how I know this information reached you, and it helps me understand what this community needs most. I read every comment personally. Now, ingredient number 1. Ingredient number 1, walnuts. Of all the foods I recommend in this protocol, walnuts have the single most comprehensive body of clinical evidence supporting their cardiovascular benefit. And they address arterial health through more simultaneous mechanisms than any other single ingredient on this list. Let me walk you through the biochemistry, because it is genuinely remarkable. Walnuts are the only commonly available nut with a significant content of alpha-linolenic acid, the plant-based omega-3 fatty acid. A single 1-ounce serving, approximately 7 whole walnuts, provides 2.5 grams of ALA, the highest omega-3 content of any tree nut. These omega-3 fatty acids reduce circulating triglycerides, lower systemic inflammation, and improve the fluidity of arterial wall cell membranes, keeping them flexible and responsive rather than rigid and calcified. But the omega-3 content is only one component of walnuts' arterial benefit. Walnuts are exceptionally rich in L-arginine, the amino acid precursor to nitric oxide. Combined with the arginine provided by the chia seeds in this protocol, the daily arginine load from this oatmeal formula provides consistent substrate for endothelial nitric oxide production, the fundamental mechanism that keeps arteries dilated, flexible, and resistant to plaque adhesion. Walnuts also contain L-argitannins, polyphenolic compounds that are metabolized by gut bacteria into urolithins, bioactive molecules with potent anti-inflammatory and antioxidant activity in vascular tissue. A 2021 study from the Hospital Clínic de Barcelona, published in the journal Circulation, followed over 700 adults at elevated cardiovascular risk for 2 years. Those who consumed walnuts daily demonstrated significantly lower levels of oxidized LDL, lower total LDL, and measurably improved endothelial function compared to the control group. The lead researchers concluded that regular walnut consumption produced effects on LDL oxidation that were comparable to statin therapy in their study population. Finally, walnuts are the only food on this list that simultaneously provides meaningful benefit for cognitive health, and the connection is direct. The same arterial improvements that reduce cardiovascular risk also increase cerebral blood flow, improving the delivery of oxygen and glucose to brain tissue. Research from the University of California, Los Angeles found that adults who consumed walnuts regularly demonstrated better performance on memory, cognitive processing speed, and attention tasks, with the improvement correlating directly with improvements in endothelial function. A small handful, approximately 7 to 10 walnut halves, stirred into or placed on top of your completed oatmeal bowl provides the full therapeutic dose. They add texture, richness, and a satisfying depth of flavor that completes the bowl. Now let me bring all 5 ingredients together into a single, practical morning protocol. Here's exactly how I recommend preparing this bowl. Start with half a cup of rolled oats, not instant oats, which have a higher glycemic index and lower beta-glucan content due to greater processing. Cook them in water or unsweetened almond milk using whatever method you prefer. Stovetop or microwave both work. While the oats are still warm, add the following in this order. 1 tablespoon of ground flaxseed, stirred in while the oats are warm to improve integration. 1 tablespoon of chia seeds, soaked overnight in a small amount of water or milk is ideal, but dry seeds stirred in immediately also work. 1/4 teaspoon of turmeric powder plus a small pinch of freshly ground black pepper. 1/2 teaspoon of Ceylon cinnamon. Top with a small handful of walnuts, 7 to 10 halves, placed on top rather than stirred in to preserve their texture. Optional additions that do not compromise the protocol: a small drizzle of raw honey for sweetness, a handful of fresh blueberries or strawberries for additional antioxidant benefit, or a splash of unsweetened plant-based milk for creaminess. This bowl takes approximately 5 minutes to prepare. It costs under $2 per serving, and it delivers a simultaneous combination of beta-glucan cholesterol binding, omega-3 anti-inflammatory activity, nitric oxide support, NF-κB inhibition, LDL oxidation prevention, and endothelial function improvement every single morning. No single pharmaceutical agent addresses all of those mechanisms simultaneously. This bowl does. One important note on consistency: the research on all 5 of these ingredients demonstrates benefit with regular, sustained consumption, not occasional use. The studies that show meaningful reductions in LDL cholesterol, improvements in endothelial function, and reductions in arterial inflammation are based on daily consumption over periods of 6 to 12 weeks. Give this protocol at least 2 months of consistent daily use before assessing its impact. Let me summarize the 5-ingredient artery-clearing oatmeal protocol clearly. The foundation: rolled oats, beta-glucan fiber that binds and removes LDL cholesterol from the digestive tract. Ingredient 5: ground flaxseed, omega-3 ALA, and lignans that reduce LDL oxidation and lower circulating cholesterol. Ingredient 4: chia seeds, arginine for nitric oxide production and endothelial flexibility, plus post-meal glucose stabilization. Ingredient 3: turmeric with black pepper, curcumin with enhanced bioavailability that suppresses arterial inflammation at the NF-κB level. Ingredient 2: Ceylon cinnamon, improves insulin sensitivity, reduces LDL and triglycerides, and directly counteracts LDL oxidation. Ingredient 1: walnuts, the most comprehensive single cardiovascular food available, providing omega-3s, arginine, elagitannins, and polyphenols that together reduce oxidized LDL, improve endothelial function, and protect both the heart and brain simultaneously.